What's a part of being a nurse that you absolutely despise? For me, it's NG tube insertion because it's no fun for me, but it's certainly not a fun procedure for the patient. But there are a few things we can do that make it a little less intolerable for our patients and try to get the procedure done with as least discomfort as possible. So a few tricks and tips that I have learned throughout the years is number one, think about your approach. I remember when I was in nursing school, I was taught to just ram this thing upward, but think about what this is called. Nasogastric, right? We're going to the stomach, not a naso up to the top of the brain, right? So you can, don't you dare screenshot, you can pig nose the patient. That's the least attractive view of me there ever was. Pig nose the patient, and we're going to advance that tube straight back, which is going to hit the back of the nasopharynx, which is where the nose meets the throat. It can bend and make that turn and go down toward the stomach. A few other things we can do is we always have a cup of water and a straw because we want the patient to chug water while after we make that turn, because their swallowing can help advance that tube down. I like to make it super icy water, really cold, because it can help kind of soothe that pain that's being caused by ramming the NG tube, or this is just my computer cord that broadcasts to my second screen, into the back of their throat. And then a few other things that I want you guys to remember. We are never, ever, ever going to put a nasogastric tube into our patients with an acute traumatic brain injury or any kind of facial fractures, because we can't guarantee that we don't have any kind of compromise in the hard palate back there, and we don't want to yoink this right into their brain. So what are some tips and tricks that you like to do to make the NG tube insertion a little less painful for your patients?